Hello, Assalamualaikum. Selamat petang semua. Good afternoon everybody. Today we are on Dr. School Live on Columbia Asia Facebook as per normal, and we are very happy to be here with you talking about another disease or condition. If there is anything that we can help you with, you know where to come. Okay, so today's topic is managing heel pain, and we are going to be talking to Columbia Asia Hospital Iskandar Puteri, Encik Adli Baharudin, who is a physiotherapist. He's a physiotherapy manager kan, Encik Adli?
Yeah.
Yes, that's right. Here we are. See the Mr. Handsome Encik Adli Baharudin. How are you?
I'm fine. Thank you, Panzakina. Yeah.
Alhamdulillah. Okay, today we are going to be talking about heel pain, right? There is a scientific name for heel pain. Maybe you can let us know what this is all about. So that viewers, okay, before that, I just want to inform you, if you have any questions as we are going with our interview, you can always type in the comment section below, and then we will address the questions on the spot. Okay, Encik Adli?
Okay, sure, no problem.
Okay, let's start.
All right.
Puteri jauh. So, okay, here we go. Physiotherapy management for plantar fasciitis. How do I pronounce it? Plantar fasciitis ke fasciitis ke?
Plantar fasciitis, yeah. Fasciitis. Plantar fasciitis.
Okay,
yeah.
plantar fasciitis. Okay, I'll just read the intro skit. Okay, when you consistently feel a stabbing sensation in your heel, especially runners semua, do not ignore it. Okay, plantar fasciitis or heel pain does not go away if you ignore it. In fact, the pain may get more intense and lead to more serious heel ailments. Okay, however, did you know that heel pain can be relieved by doing some simple exercises? So this is why we have Encik Adli Baharudin here today, because he will explain to us exactly what heel pain is and how we can manage it. Okay, all the best. Over to you, Encik Adli.
Okay, thank you, Panzakina. All right.
No problem.
Before I start with plantar fasciitis, I just want to go through briefly about our basic anatomy of the
Okay.
foot, because
All right.
yeah, it is easier for the audience to understand as we discuss later on. So as you can see in the picture, there is a whitish band that across at the bottom of our foot. As you can see, there's a plantar fascia, and this structure is what we call is a connective tissues, and it's a very thick and strong.
Okay? Is that a muscle?
No, it's a connective tissue. Yeah, it's a fibrous tissue, connective tissue.
Okay.
It's not a muscle. Yeah.
Okay, it's not muscle. All right, got it.
Okay. So these tissues, this plantar fascia, it is attached to our heel bone, and attached to our phalanges or our toes. Okay.
All right.
So these structures, what we call function as stabilizers for our foot. And when we walk or when we do any activities, especially when we weight bearing, this plantar will help to stabilize our foot and to maintain our arch in the ideal position. So that is what is plantar fascia. Yeah.
Okay, but sorry, when you say weight bearing too, what does it mean exactly?
Weight bearing is activities that when we put on weight in our body. So when we walk, when we jump, anything that we put on weight,
Okay, so it doesn't necessarily mean angkat berat lah, not that kind of weight. Can it also be obese? Weight bearing?
Yeah, that one is one of it. But weight bearing is activities that we put loads in our foot, I mean in the joints.
Okay.
Okay. In this plantar fasciitis, this structure, this tissue or plantar fascia is is inflamed or has been there is some irritation or what we call degenerative changes in these tissues. So because of this, it will cause stabbing pain, or sometimes sharp pain or discomfort around the heel region,
Okay.
and at the arch areas. So that's why it's famous as a heel pain. That's the reason why. Yeah.
Okay.
Mhm.
Okay, so that is what plantar fasciitis are. Okay, now let's take a look at the causes of heel pain and what are the risk factors.
So the causes for this plantar fasciitis, it is because of the micro trauma of the
Okay.
plantar fascia, yeah, of the tissues. So
Okay, that sounds very technical. What is that exactly?
microtrauma is like like micro injuries, especially
Okay.
to the structure of the bone of the heel of the tissue
Mm.
around that structure. So it is
Mm,
something
mm.
that you cannot see as invisible because
Very
it's
small lah, yeah lah.
very small. Yeah, very small.
Okay, all
So
right.
our body will heal by itself.
Oh, okay.
So the process of need this micro trauma and healing
Mm.
process
Mm.
repetitively. So
Yeah,
later on, it will develop, inflammation and irritation to the tissue.
yes,
So that is why later on, patient will develop pain and discomfort around the heel region.
I see.
That is the
Okay,
causes.
okay.
And
Is that the only cause because
yes,
of micro trauma?
again, once again, I couldn't hear you.
Is that the only cause for plantar fasciitis because of micro
Yeah,
trauma, or there are other causes?
the main causes is a microtrauma, but there are
Okay.
risk factors that contribute to that trauma. Yeah.
Okay, okay, all right. So the cause of the pain is micro trauma, but then let's see how micro trauma happens, right? And
Yeah.
those are the risk factors lah. Okay, all right. Let's take
Yeah.
a
Yeah.
look at that.
Definitely. Okay.
Okay.
So the risk factors is for people that age between 40 to 60 years old. They
Okay.
are common to get this kind of problem, especially for women.
Why?
And
Is it because women wear high heels?
yeah, maybe because of their some of their foot mechanics or foot structure because
I
of the
see.
heels. Yeah,
Yeah.
so that one. Okay. The other is certain types of activities.
Yes.
For
For
example,
example?
yeah, like long distance running,
I see.
marathon or
Yes.
aerobics, high impact aerobics, and maybe dancing activities, which involve a lot of
Oh.
foot
Oh,
activities.
ya ke? Oh, okay. Because
Yeah,
I do Zumba, so now I'm nervous as well in case I
yeah,
get heel pain. So far, so good,
correct.
but you never
Mhm.
know.
Yeah.
Okay. What else is there?
Okay.
Foot
Uh,
mechanics. What does it
the
say?
other is foot mechanics. In short, it is I can say that is the structure of the foot. I think as maybe I can say like people with flat foot or
Yeah.
people those who have an high arch,
Yeah.
they have a risk factors to develop this kind of plantar fasciitis problem.
Okay. So
And
this is something that
okay.
you are born with lah. Yang flat foot, poor footwear. Oh no, poor footwear is different. But when we are talking about foot mechanics, it's something that you cannot control
Mhm.
because you
You
are
know,
born that way.
no, some people they are born with it, but some people they develop it later on.
Okay. All right.
So so that is why I emphasize that there's a uh, later on I will emphasize on footwear, which might
Okay.
help to reduce it. Yeah.
Okay, that's good.
And
Thank you.
okay.
Nature
So
of
the other
job.
is nature of job. For example, for those who are working in long hours standing, uh, long hours walking, so they also have a risk to get this plantar fasciitis.
Yeah.
And the last one is, like you mentioned previously, is obesity or overweight,
Yeah.
because as you know that when we have extra weight, extra kilos
Correct.
in our body,
Yes.
there will be
Yes.
extra stress on the heel or around the foot. So that is why it is also a risk factors.
Yeah lah. Obesity, a lot of complications kan. Okay, now let's take a look at the symptoms.
Okay, for sign and symptoms, the most famous one is pain or stabbing pain that is severe during, I mean, in the morning.
All right.
So it is most of our patient they will feel pain when they start to get up from the bed. The first few steps they will feel severe or stabbing pain.
Oh, okay.
But after they walk for a while, the pain will gradually reduce. So this is the
I
most
see.
common symptoms. Yeah. And other than
Okay.
that, they there is a tenderness around the heel and near the arch of the foot. As you can see in the
Okay.
picture beside in the
Yes.
diagram, 52% patient complains of pain around the heel, yeah, around the heel.
Yeah.
And the second one is around the arch of the foot. Lah. So
All right.
that two spot is the most painful area for plantar fasciitis.
I see.
And then patient also will feel discomfort or stiffness
Okay.
around the foot and the heel region. And also when the patient or the people who have this kind of problem, when they are carry
Yes.
heavy objects or lift heavy some object, they will feel more pain.
Right. I see.
And the last one is the pain will subside or the pain will reduce when they rest. I mean, when they put their leg off from the, I mean, non-weight bearing. So it will reduce the pain. Okay.
Oh, I see. Like when you put your feet up lah, when you're
Yeah,
not
we put,
actually standing. Okay. Well, the what you mentioned just now, when you wake up in the morning and then you start walking, and then you get the pain, but later on it will go away. So it's not plantar fasciitis. It's not something that you feel all the time when you are standing.
uh, in this plantar fasciitis, the special about it is because most of the patient will complain the pain is severe during the first few steps. So
Okay.
later on, when the patient do activities, it may aggravate later on. But it is
Right.
very consistent that patient will complain pains in the morning. Yeah,
So if you don't do anything, it will just get worse lah, of course.
yeah.
Okay, okay, all right. Can I ask what are the triggers of this pain? Like when you sleep and then you wake up, suddenly you feel the pain, but how does it happen? Because it's not like you baru main sports kan and then suddenly you rasa sakit, but you baru bangun tidur pun dah sakit.
Okay. Um, during when we sleep at night, okay, we don't move our foot, right? We just rest it.
Correct.
So
Yeah.
when we try to step in the morning, when we just put our weight on our foot, our
Right.
plantar will be stretched because it
Uh,
works as a stabilizer for our foot. So
yeah.
when we
Right.
put
Right.
on weight, it will stretch. So it will cause pain during that few steps. Later on,
Okay.
when the circulation is improved, that's why it become reduced. Yeah.
Okay. Okay. All right. Okay. If there is any other triggers that you would like to share with us.
Other than that is some patients also will feel increase of pain after activities. After vigorous
Yes.
activities, they will feel more pain.
Yeah.
Yeah, that's the
All right.
common one.
I mean, based on your experience as a physiotherapist, I'm sure you have many patients who have
Yeah,
come
sure.
to you
Yeah.
and complain about all these heel pain. Lah. Maybe can you describe what does the heel pain feel like?
It feels
Usually,
like
patients too, when they come to you, what do they say about the pain?
they will feel they will complain of stabbing pain. That is the words. Stabbing pain around the heel and sometimes near the arch of the foot. That is the most painful area.
Okay.
Okay.
Okay, so let's take a look at what patients should do.
Okay. As a physiotherapy,
Yeah.
I would encourage that for patients who experience pain around the heel or around the foot, first of all, they should see professional, go and see the doctor first.
Yes.
Let the doctor check thoroughly what is the main cause of the problem.
All
So
right.
most of the time when doctors prescribe medication for the patient, doctors will refer to physiotherapy. So
Yes.
as a physiotherapy, I can say that we have a very good and effective treatment for patients with this condition.
Okay.
This is because physiotherapy we are non-invasive, so we don't
Yeah.
involve in any we don't do any surgery, we don't use medication, we
Correct.
just treat
Yeah.
it using some modalities, exercises, so
Yes.
it is safe. Okay. And as you know that patient sometimes they are scared to go for injection and others. So we are one
Yeah.
of the options that they have, right? And as a physiotherapy also, we are not only able to help to reduce patients' pain, we also will teach them how to strengthen their muscles, their foot muscles, so that later on it will have a better recovery. I mean, in the long term, it's better for them. So
Okay.
that is why patient with plantar fasciitis,
Yeah.
they should come and do physiotherapies. Yeah, physiotherapy. Yeah.
Okay. Encik Adli, when you go for physiotherapy, is there a chance that heel pain will go away eventually, or it's just to manage the pain?
Uh, I can say that it depends on the how severe is the conditions. Normally, if the patient
Okay.
comes in the acute stage where the pain is very minimal, it can be
Yeah.
tackled easily, and we only will take a few sessions to improve the patients. But of
Right.
course, the
Okay.
chronic case it will take quite some time. Yeah.
Okay. But it's not permanent lah. This pain you can get rid of it. I mean, by doing treatment, physiotherapy and whatnot. But it doesn't mean that once you get heel pain, it's permanent.
No, it's not permanent. For plantar
Okay.
fasciitis, if you manage it correctly, 80% to 90% it can improve by physiotherapy.
Okay. All right. I see. So that's addressing that question about how long it takes to get better, yeah?
Yeah, yeah.
All right. Okay, I think you are going to show us about some of the ways to ease the pain and how physiotherapy can help.
Okay. All right. For plantar fasciitis, physiotherapy, we focus more on the pain. So we have three main approach to treat this problem. Okay. So first of all, patient will come with pain, so we have to tackle the pain, and later on we will educate and teach the patient how to do exercises for long-term recovery. So here, as you can see in the picture,
Yeah.
there is the machine that we use to treat the heel. Okay, so the first option for physiotherapy to treat pain is using electrotherapy.
Okay.
Electrotherapy, which means that we are using modalities or electrical modalities as our tools
All right.
to reduce pain and increase the recovery for the patients. So currently we have like laser therapy. We also have shockwave therapy, like in the picture,
Right.
and we also have TENS, which like electrical stimulation to reduce the pain.
Yeah. Yeah.
Yeah, and we also have like infrareds and also the cold treatment or heat treatment. So
Yeah.
in my experience, I can say that shockwave therapy is one of the best and effective modalities that we can offer to patients to treat this
Right.
plantar fasciitis.
I see. All right.
Okay. Besides
Sorry, yeah,
the
sorry to
yeah,
interrupt you again, but the treatments that you showed earlier,
mhm.
are these things that you can do at home? Atau, I mean, tents because it's possible, kan? You can actually
Yeah,
bring the
yeah.
tents equipment everywhere you go. So kalau sakit, you can just pasang. But what about shock therapy? Apa ni? Laser therapy. Are these
Laser.
things that you must do at the hospital, or something you can do at home?
Okay, like you just said before, TENS you can apply it in at home, but
Yeah,
for laser therapy, shockwave, it requires a trained person to do
professionals.
it.
Yeah.
Yeah, so you have to come to the hospital. Yeah.
Okay. Cold pack and infrared ni, of course, you can do it at home lah juga.
This one you can do it at home. Yeah, that one you can do it at home.
I see. Okay, okay. All right. These are exercises.
Yeah, for exercise. So as I mentioned before, we have three main approach. The first one is to treat the pain. The second is to to strengthen and to stretch the tissues
Okay.
to make what we call to improve the recovery of the condition. So this is the most important part of treatments because
Yeah.
this is the thing that patient must do at home regularly. You know, because machines patient can come to hospital maybe 2 3 times per week, but exercise they have to do regularly at home. So
Yeah.
as you can see here, I just mentioned about 4 types of exercises
Yeah.
that patient uh, can do. But later on in the last session, we will show some videos how to do some exercise.
Okay.
And the other approach that physiotherapy can do is manual therapy.
Okay.
And manual therapy is something that is a hands-on skill, which means that the therapists have to do some like soft tissue release or massage or like I mentioned, there's a myofascial release with the special
Yeah.
techniques,
Yeah.
to release the tissue. And in some condition, we also might use dry needling if necessary.
Okay. This manual therapy in dry, are you going to demonstrate later?
Uh,
That sounds very
for
interesting. Needling, what is that exactly?
Yeah, for manual therapy, we will not show it. I mean, in demonstration, we only teach
Okay.
some exercises. Yeah.
All right. Okay. Okay, let's continue. Stretching and strengthening. There you go.
Okay. For other managements, this is something that patients can do at home. For example, is like taping and strapping. As you can see in the picture, there is there's a picture of the foot and there's
Yeah.
the tape, right? Okay.
Mm.
That one is good to support the tissues of the foot.
Okay.
So as a physiotherapy, we can apply it to patient, and also if patient knows how to do it, they also can do it at home. Okay, so this is the some of the example of the tape that can be used. This is
All right.
sports tape. All right,
Mm.
and the other thing is the shoe insole. This is also important because, like I said in the early slides, the foot structure is important in the risk factor, right? So for those who have flat foot or high arch foot, they requires this insole
Yes.
to to at least reduce the stress on the plantar or
Right.
on the foot. Yeah. So this is one of the example that what we have here. This is one of the insole. So this
Ah,
one,
so,
you can see the arch here over here.
okay.
So for those who have a flat foot, when they use it, this will support the problems area. So
Yeah.
this might help for some patients. Okay.
If patients want to buy that, what is it called and where can they buy it? Can they buy
I
it
think
at Columbia Asia Hospital Iskandar Puteri?
yeah, I think most of the Columbia facilities in physiotherapy department they will have this kind of shoe insole. Maybe different
Okay.
brand, but most of
Okay.
them will have this one. Yeah.
But so you just say you need a shoe insole for heel pain.
Yeah, but of
Okay.
course, the therapist will assess what
Yes,
is
of course.
exactly the problem. Yeah,
Okay.
and okay, okay. Then the other management is a proper footwear. So um, I advise that maybe those who have plantar fasciitis can use a proper footwear. For example, if they are going for activities, outdoor
Yeah.
activities, they can use
Yes.
sports shoes, proper shoes, and also at home also they can do some, like massage, self massage by using the ball or a roller like the picture.
So it looks
Okay.
like there are things that you need to do at the physiotherapy center, and then you
Mhm.
also need to follow up by doing some exercises at home.
Yeah, that is necessary to have a better
Okay.
outcome.
Yes. Okay. All right. Do we have any other
Okay.
slides? Okay. All right.
Hmm.
Some tips and advice.
Right. Okay. For plantar fasciitis, I will advise that uh, please use proper footwear uh, that is suitable to activities. If they
Okay.
are if they are going for sports, please wear the sport shoes and which is suitable. And then select suitable exercise, which means that if you have pain during for example long distance running, maybe you
Right.
can try to try different kind of exercises that helps to to reduce the tension of the foot. So later on,
Okay.
when you get better, you can return back to the 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 activities that you love to do. Okay, and
Okay.
then like previous, I'll say that you need the shoe insole if you have
All right.
problem. And then for acute phase, maybe you can put ice pack or ice massage. And this is only for in the acute stage. I mean, the pain is still new. Maybe it is suitable to put an ice pack around that pain area.
Yeah. Yeah.
Other than that, is try to reduce weight for patients with extra weight
All right.
or overweight. And last but not least is to seek professionals because they
Yes.
are not only try to reduce the pain, but they will also help to find the root of the cause why
Yes, that's
this
right.
plantar fasciitis is happening, right? So that is my advice.
Thank you very much, Encik Adli.
All right.
Oh, okay, here we
Problem.
go. Exercise demonstration. It should be interesting.
Okay. So here I'll just will share some of the exercises which is quite common for plantar fasciitis patients. But I would like to emphasize that from patient to patient is sometimes is not everything that you can do. I mean, just by following in the video.
Yeah.
Maybe you have to you have to come and have a proper assessment. Then we will prepare a tailored, specialized exercise that suits to their condition.
Okay.
Okay.
So this is basically just general
General exercise.
stretches like exercises. Okay, but still you need to see a professional
Yeah, still.
in person. Okay. All right,
Okay,
let's
so
take a look. What are we looking at right now?
okay, this is the first exercise is stretching of the plantar fascia.
Okay.
As you can see, okay, slow down a little bit. Okay, stop there. Okay, as you can see here, the model is holding the toes and
Yeah.
also holding the heel there. So it is just a simple stretch, and the patient should feel a slight stretch around the area of the plantar. So this exercise, I will suggest that maybe you can hold for 1 minute, and maybe you can repeat it for 5 to 10 times, and maybe you can do it 2 or 3 times per day. This is for a general stretch for the plantar fascia. Okay, so this is the first exercise. Okay, next. Okay, this is the second exercise. Okay, stop there. Right. Okay, stop. Right. Okay, in this picture, we are going to do some stretching for
All right.
the plantar fascia and also for the hamstring and calf muscles.
Okay.
So it just simply by sit in long sitting like this, put the hand forward, make sure the knee is straight, the body is bent forward a little bit, and just move the ankle only, just like that. Okay, slowly up and down, just like that. So okay, stop there. So
The ankle. How exactly do you move the ankle? Maybe we need to see the video.
please repeat again.
Uh,
We'll just focus on. Okay. Okay, stop there
oh, I think
first.
we lost you for a while there.
Hello.
Hello? Encik Adli, are you there?
Yeah. I'm here. I'm here.
Hello? Encik Adli?
I'm here. Yes.
Okay. All right.
All right.
Okay. Yes. It's okay. You can continue explaining.
Okay. All right. Okay.
Because there
Okay.
was a
Can
bit
stop
of
there.
a connection problem earlier.
Okay. Can you start back the video again? All right. Okay. Stop there. Okay. So first we start in this position. The leg is in the straight position like this, and the knee is in the straight. Okay. So okay, try to proceed now. Okay, make sure the knee is straight. So the movement is only happening at the ankle only, as you can see. Yeah, from there up to there only. But even though it looks simple, but for those who have a tight hamstring or tight, calf and plantar, tissues, they will feel very painful. So it seems easy, but for those who have plantar fasciitis, they will feel pain while doing this. So it should be very slow and careful. So this
I think the
exercise,
viewers who are looking at this, they are also doing it at the same time because you can do it right now.
yeah.
Interesting, so that they know whether they have plantar fasciitis or not.
So
Okay, sorry. Yes, carry on.
yeah, I suggest this exercise. It is best to do it like 10 repetitions for the ankle movements and
Okay.
repeat it for 3 times. So you can do 3 sets per day also can. Yeah.
Okay.
Right. So next video. Okay. All right. Stop there. Okay. As you can see, this is a very simple exercise, but it is important because it helps to strengthen the foot muscles.
Oh, I
So
see.
as you can see that the toes curve, right? So even though it looks like simple, but for
Yeah.
those who have like plantar flat foot, it is good for them to train the
Yes.
muscles. Yeah. Okay.
So what are you doing here? Actually, you are
I just
pinching the towel
no.
with your toes.
Yeah, it's like you are pulling the towel and
Okay.
just let go like that. Yeah.
All right.
So
Okay.
this is
All
also the
right. That's
same.
clear.
Okay. This is also the same like before. It just the difference is this in this picture is using all the toes. In the first one they're using only the big toe only. Yeah, that's the only difference. Okay,
Yes.
right. Okay, so
Ah, I see.
the
Okay.
last
So which
exercise
which
is
one is the correct?
okay. All right.
Okay.
Okay, this is the last exercise. This is
All
we
right.
call like a loading exercise, and this one is important to train the foot muscles and also to to help build the strength for the plantar fascia.
I
Okay,
see.
this exercise should be done carefully and being monitored by a professional because if you are doing it incorrect, it might cause pain to the to the ankle or in the calf region.
Yeah. This one looks a bit more complicated than the others.
Yeah. In this picture, you cannot see the hand, but you can hold the something to stabilize your body also
Yeah.
while doing this. Yeah, while doing this. So I suggest that this exercise, uh, you can do it like for example when you get up, wait, okay, stop there. We'll
All
just
right.
stop for 2 seconds here, and then we just return to the normal position. Okay, like this. So we repeat it for like 12 repetitions for 3 sets. And this exercise should be done, like every other day. I mean, alternate days, not every day.
Okay.
Yeah, and it should be continued for like 2 weeks before we progress with the others exercises.
Okay. Oh, you're welcome. Okay, Encik Adli, the exercises that you showed us just now, so there are 4 types of exercises
Yeah,
and you need to do this every day except the last one lah yang you were saying this only for
yeah,
if you are
except the
guided
last
by a
one.
professional. So that's every
Yeah,
other day.
yeah, every other day.
I see, okay. So you have to go to the physiotherapy center every other day to get that done, or is that something that you can just do if you
I would
learn how to
suggest
do it
that
correctly?
I would suggest that they come to physiotherapy maybe 2 or 3 times per week because we will incorporate these exercises with the machines so that it
Okay.
will enhance the recovery process. Yeah.
Ah, I see. Okay. Yeah lah, to speed up the process. Yeah, okay. Well, we've got quite a few questions here actually. Thank you so much for all your explanations just now. Sorry if I
Yeah.
kept interrupting you because it's so exciting. If I
No
tak
problem.
interrupt means like it's just going straight. But it was
Yeah.
very it was an eye-opening talk. Okay, we have everybody says hi to you, Encik Fahmi, Encik Barjish, Fakri Hamzah. They all your fans. Okay, Encik Fakri Hamzah has a question here. Could mind shoes be one of the factors that causes heel pain?
Could my shoes one of the factors of pain? Okay. I can say that this is quite subjective, but if the shoes really, supports the arch of the foot and really stabilize the foot during movement, it should be no problem. But if the food is, sometimes we have been used for quite some time, I mean, maybe for years, the food, I mean, the shoe itself maybe have, have some become, I mean, the arch maybe become less or not really support. It also can cause plantar fasciitis.
Okay.
So it can
So
be,
footwear is really important.
Footwear, yeah.
Okay. Do you have any advice about footwear? Like, what kind of footwear that runners or just people who are at risk of plantar fasciitis, what kind of footwear should they be looking for?
For
About
the
socks.
for those who have plantar fasciitis, they should identify their foot structure first, whether they have a high arch or they have a flat foot. So from there, they will have they can decide what kinds of sport shoes that they need to buy. But for those who have no issues, I mean, no plantar fasciitis, no pain around the foot, they have to use a proper shoe before they develop this kind of problem.
Okay. So that's okay. Yes, that's vital. And okay, Ms. Gwen Yap is asking, can foam rolling the calves help? What do you think?
Can foam rolling the calves help? Yeah, you can do foam rolling. It is same as as you do some massage, but foam rolling is more, I mean, easier to do. And I can say that if you have plantar fasciitis due to the tightness or due to some trigger points over the calf area, it can help to reduce the pain. Yeah, it can help.
Okay, now it's getting quite popular, the foam rolls for exercises and whatnot. Okay, let's have one, everybody. Miss Carrie Lim is asking, how long will it take before we can see the effects of physiotherapy treatment? This is a good question. So if you've been doing all those exercises that you recommended, and then how long after that will you be able to see an effect? Just as Miss Carrie is asking.
Yeah. According to my experience, you can see the effect of treatments maybe after 3 or 4 sessions of physiotherapy, but it depends on what stages your problem is. If you're coming with a very very early stage or there's an acute phase, it is quite fast to recover. But if you come with a chronic case, maybe it will take longer. But I can say that between 4 to 6 sessions, you should feel at least 50 to 60% reduce of pain.
Yeah.
Hello.
The last question here from Encik Adiba, from Miss Adiba Jaafar. Hi Encik Adli, why just numbness at my fingers and toes? Would this have anything to do with plantar fasciitis? Numbness on the fingers and toes?
I can say that for plantar fasciitis, the most common complaint is only pain and stabbing pain around the heel and sometimes around the heel and the arch of the foot. So if you have numbness at the toes or fingers, I think there might be different kinds of problem which you should go and see the doctor.
Sorry, Encik Adli, I think you have to repeat that. Can you hear me?
Yeah, I can hear you.
Okay, all right. Because you sort of went off just now, so it's just back. Can you repeat your answer?
Okay. Normally, plantar fasciitis will only makes the patient feel pain around the heel and arch of the foot. So if the patient have numbness, around the toes or fingers, that might be a different kinds of problem, which maybe you can see doctors to rule out if there is any other conditions that related to the foot.
Okay. Okay.
Yeah.
All right. So, do you have any other advice before we wrap up the show? It seems that that's all the questions that we have for today.
Okay.
And ladies and gentlemen, if you've got any further questions, or if you feel that you have any of these symptoms that we've spoken of, maybe you would like to go and see Encik Adli Baharudin at Columbia Asia Hospital Iskandar Puteri if you live in Johor lah kan. If not, you can still go and see him anyway. He's the expert here that can help you manage the pain from plantar fasciitis.
Yeah.
Yes. Okay. So with that, we'd like to thank you very much, Encik Adli, for your time.
Thank you. You're welcome.
Any words that you would like to say to our audience?
Okay. I would say that for those who have these kind of issues, especially around this Johor Bahru or in this JB area, if you have this kind of problem, do come and maybe we can at least try to offer some like solution for this kind of problem, because this is quite a common case, but if you not take care of it, it will get serious later on.
Yes. Okay. So better not wait. Okay. Thank you so much, Encik Adli, for your time.
You're welcome.
Okay. Bye, everyone. See you guys again, inshallah soon. Bye.
Bye.